I know you're excited for this. We're going to talk about business school, business skills, things you're going to need to know as you start your new profession. Okay, so nurse managers, as you know, are in charge of the day to day running of a unit. They have budget preparation responsibilities, but they're going to ask for your input on budget preparation, and they need to plan for staffing. All nurse managers need to plan for that. Now, the budget preparation, it is a learned skill. It takes a while to get the hang of it. But there's two types of budgets, okay? And this is what you need to know. There's an operating budget, which is your day-to-day supplies, electricity, personnel that you need, and then the capital budget, which is for huge ticket items, things that cost a lot of money, like a new wing to the hospital. Maybe you want some new um, computers, technologies throughout the whole hospital. I mean, that's a big expense. New equipment that you want. Resource management. So as a nurse, you're going to be asked to use supplies wisely, not to waste money, not to bring a bunch of stuff home in your pockets, right? We want to prevent complications to decrease the cost of healthcare, coordinate referrals, all that stuff is important, okay? Um, this table right here, healthcare facility budget comparison. This is just giving you some ideas of what would go on the operating budget versus what would go on the capital budget. Okay, it's pretty simple. A big ticket item is capital budget. Staffing is your largest expense, so that's why we're always trying to use new staffing mixes. Okay, to see what's going to work and alleviate the care burden. So your nurse manager, actually HR is going to recruit you. Nurse manager is responsible for it, but HR does it usually. And to make sure you're credentialed, so when you first start in your practice, you're going to be asked for your eligibility to test, and you'll have to show that to your nurse manager that you have it, so that you can work as a nurse during the time you're waiting to take your NCLEX. Okay. You'll go to an interview. Sometimes they do panel interviews. Don't panic, okay? But prepare. Have it, go over in your mind what kind of questions you think they might have. Use ChatGPT for that. You're going to be oriented to the unit and also to the hospital or the organization, okay? The staffing models. Okay, so you have to know about staffing models. You are most likely going to go to a facility where they use team nursing. So as the RN, you would be the head of the team. You would be given some LPNs and also some UAPs. Okay, most hospitals have pivoted to team nursing. Functional nursing is good if you're really short staffed because it gets the job done. You're only going to do what's absolutely necessary. I see this done in long-term care a lot of times. There's a nurse that's a charge nurse, there's a nurse that's a medication nurse, a nurse that's a treatment nurse, does all the dressings and the wound care. The problem with it, patients feel like it's disjointed, it doesn't coordinate all their care together, but it is really good in emergency if you need to get a lot of tasks done. Primary nursing is relationship based. And when I first came into practice, I worked on an oncology floor, and this is the way we practice primary nursing. And it's really good for relationship building. And if you think about it with oncology, I saw those patients over and over again because they'd come in for their surgery, debulking, and then they'd come in for chemo, or then, they would get sick and they would come in, they would be neutropenic. So it was really good for that. But the problem with it is that it doesn't use resources wisely. Remember, human resources need to be used efficiently. So I think that's one of the reasons we moved away from that. But also getting LPNs back into the hospital was a great idea as well. Now, when you start your new job, I want you to ask what your FTE ratio is. an FTE, one FTE equals 40 hours per week of working. That which means you work 80 hours in a pay period. A pay period is 2 weeks. Okay, and we did this exercise in an activity we did class. So if you're at 1.0 FTE, you could work 5 days a week, 8-hour shifts. You could work 3 days a week, 12-hour shifts, and then one 8-hour shift on the other week. Okay. You could work 4 days a week, 10-hour shifts. That was one of my favorites. And then you can work 2 days, 16-hour shifts, and one 8-hour shift per week. Okay. With your FT math, all you do is get your FTE, whatever your manager tells you what your FTE is going to be, multiply it by 40. That will tell you the number of hours you're going to be working per week. And this is important. I'm going to tell you why. No nurse manager wants to be accused of having FTE leakage. So if you're a 1.0 FTE and they tell you you're going to work 3 days a week, the question you need to ask is, will there be a time where I'll need to work another 8-hour shift in those 2 weeks to get up to 1.0 FTE? Okay, because they can't, if you're only working 3 days a week, you're not working to your full FTE. So that's just a little tip for when you start your nursing practice. Make sure you know what your FTE is and what it means for you.